Welcome everyone to our education session this afternoon. My name is Annette Johns and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador Association of Social Workers. I have the honor of being the moderator for today's education event, Acceptance and Commitment Therapy, Practical Implications for Clinical Practice and Personal Well-Being. This is a topic that is of great interest to social workers, and we have over 450 social workers from across the province registered for this event today. It's always so wonderful when we can come together as a profession to learn from our social work colleagues and enhance our knowledge and skills with the goal of providing clients with the highest quality service. Sessions that focus on a therapy or a practice intervention always generates a great response and is an area where social workers highlight the need for continuing education. This webinar is a collaboration between the Newfoundland and Labrador Association of Social Workers and the Canadian Association of Social Workers. The webinar presentation will be approximately 60 minutes, followed by a 30-minute question and answer period that I will moderate. Please send in your questions throughout the presentation, and only myself and the presenter will see the questions. All of the housekeeping details you need, like how to access the recording, where to download the slides, and how to get your certificate of attendance, are all included in the housekeeping widget that popped up when you first logged in. I now want to introduce our speaker, Lori Pinhorn. Lori is a registered social worker and holistic naturopathic therapist with over 20 years of experience working in the field of mental health. She holds a science degree in psychology and biology from Acadia University in Nova Scotia, a social work degree from Memorial University here in Newfoundland, Labrador, and a master's in holistic nutrition from the Edison Institute of Nutrition in Ontario. She is also a Schenker certified self-read practitioner. Her private practice focuses on individuals and families who live with mental health concerns. Her main counseling areas of focus are anxiety, developmental trauma, depression, ADD, ADHD, and autism. She also works with groups and corporations to design and deliver holistic wellness programs to optimize mental health and physical health. Her programs and interventions are acceptance and commitment therapy, cognitive behavioral therapy, and self-reg therapy. Her private practice currently offers a wide range of online learning opportunities related to restorative self-care, nutrition, mental health recovery, and family interventions for children struggling with emotional regulation. Lori has facilitated previous education events for her social work colleagues through the NLASW and has been a contributor to NLASW's Connecting Voices newsletter. Lori is a passionate and engaging speaker, and without further ado, I'll pass things over to Lori to begin the presentation.
Thanks so much, Annette. So we're going to spend 60 minutes talking about acceptance and commitment therapy today. I just want to say at the beginning of this that we are really scratching the surface of acceptance and commitment therapy here with this 60 minutes. This is just an example. Tonight I'm running an hour workshop on just one of the slides on this. So we are really going to scratch the surface here. And what we're going to try to cover today in this 60 minutes and question is the journey, the developmental journey and the history of ACT. Lots of people call ACT, but really we should be calling it ACT because it is a very active type of therapy. So the world leaders in ACT really suggest that we start calling it that. Today, what we're also going to talk about and touch briefly on are the 6 core ACT concepts and how they work together. We're going to explain them in individual terms with the understanding that they really do work together. It's hard to really separate them, but from a technical perspective, we're going to just try to look at them individually for now. We're going to give you a couple of hands-on ACT activities that you can start practicing. ACT is, like I said, a very active therapy, and it's a therapy where, you have to gather resources, active resources, and you're using them in your therapy sessions with people. That's one of the things that I love about this therapy, that is very interactive. And we're going to, on the last several slides, talk about some book titles and digital resources and training options if you decide to develop your ACT journey personally or professionally. So here we go. So There's stuff popping up on my screen there. Okay. So acceptance and commitment therapy is considered to be one of the third waves of cognitive behavioral therapy. It is the foundation, some of the foundations of cognitive behavioral therapy you'll see in the ACT therapy. And so people have been trained in that area. Some of this is going to sound really familiar. I had done some training in cognitive behavioral therapy several years ago at the Beck Institute, and they are even now adding on some of the acceptance and commitment therapy into their CBT training. And if you've ever done any mindfulness CBT training, then you're probably going to see some similarities here as well. So it is a type of therapy where we're using acceptance and mindfulness techniques alongside some of the scientifically proven behavior change strategies to help people live in alignment with the things that are really important to them. It's a very individualized type of therapy, and it's a type of therapy that, even though there are some things happening in people's lives, that they can also build some joy and fulfillment into their lives. Those two things can coexist at the same time. And while the T in ACT stands for therapy, the ACT concepts go way beyond that. They provide a framework of an understanding of what it is to be deep, like the deep understanding of what it is to be human, how we all sort of have common denominator thought streams, and that's some of the human experience, and some things that we just can't, there's no magic delete button in the human experience sometimes. We do have streams of thoughts that we just have to accept are there, and it's a type of therapy that also helps you live a life full of purpose, openness, vitality, and fun, even though you are surrounded by things that could be struggling for you, either physically, emotionally, and things like that. Did I go ahead of slide? Sorry, guys, I'm just technology here. So here is ACT in a nutshell. So this might sound sort of counterintuitive if you are somebody who was trained in cognitive behavioral therapy or other types of therapy. So ACT really requires us to have a shift in perspective, and we're asking people in the ACT and in the acceptance commitment therapy world to do things that might not feel good, but the end result is that people do feel better. So ACT shows us a way to move forward in the face of life's many hardships. And one of the realities of living a human life that's full of things that are important to us is that we are going to experience hardships in our life. We experience pain in life areas where we care. So because we have a life full of things, eventually we are going to feel hardships and pain, and that's part of the human experience. And ACT shows us how to reduce the impact of the painful thoughts and feelings, and this is where the acceptance piece comes in, that we are going to have thoughts and streams of thoughts that are going to create some painful experiences for us, and how do we accept that life is full of not only wonderful things, but also things that are going to cause us some struggles. And at the same time, you can take action to build a life that's full of meaning. And so this is the commitment piece to the ACT world, and I love the commitment piece to this is because this is where we get things done. And at the end of every session that I have with people, one of the last questions I always ask is, based on the conversation that we had here today, what makes sense for you to be working on until we meet again? And again, that's not me saying what people need to be working on. It's what people are saying, yeah, this is not my important thing that I'm going to work on. And there is a commitment piece to this, because sometimes wanting things to get better doesn't get better just because we want it. There is work to it. And the commitment piece is really where the action happens. And ACT is a valued-based behavioral therapy. So what that really means is, and there's assessments that you can do with your clients to kind of figure out, well, what are the big values for the people that you work with? So when you start to lift up what's important to people, that sometimes is the motivator for the commitment piece, because I'm doing this because it's really important to me. It's really important to this core value that I have. So the value piece cannot be underestimated. It's the value piece is really a piece that since January I've personally been working on myself is to kind of really understand the value piece deeper. So, action of ACT is a combination of acceptance and mindfulness processes. It adds commitment and behavioral processes that are interweaved with personal values for the purpose of creating psychological flexibility. So we're going to talk a little bit about what psychological flexibility means. And it's the opposite of cognitive flexibility or psychological flexibility would be something like cognitive rigidity. So when we live with anxiety or depression or emotional dysregulation issues, we're constantly sort of caught in this cognitive yes or no, black or white, this way or that way, get done now. Those kinds of cognitive schemas are there for people. And what we're trying to do is create a psychological flexibility where people hover above situations and ask themselves, how do I want to react to this situation? How do I want to think about this situation? And so the psychological flexibility is sort of the outcome of all of the key components of ACT working together. It's kind of hard to describe psychological flexibility in theory, but when you see it acting out, you know when you see it. There's a flexible flow with people. There's a cognitive flow with people. People are catching streams of thoughts that would normally sort of take them down the rabbit hole, and they're actually making thought adjustments. And I can see flexibility moving in people, and it takes sometimes several sessions to see that happening, but when you see it happening, you'll know it. It takes behavioral theories and adds them to wisdom traditions. So the wisdom traditions are things like mindfulness and meditation. And mindfulness and meditation is really on a liftoff in our North American world anyway, not so much in other cultures. But we're using mindfulness and meditation in ACT, not necessarily for the same purpose that, say, Buddhist monks would be using it for. Like they're using it for some things like ego destruction or trying to, deepen their meditation practice so that they can sit there for their hour or many hours, whatever it is that they're reaching for in their mindfulness and meditation. And I often even move away from even using the words mindful and meditation with my clients because sometimes people have the experience that they try to do that and they think that they're not good at it. So I give people the experiential idea in a session with a mindfulness practice, so they get to see in real time the benefits of it and help people understand that, of course, your mind is going to wander while we do this. You're not supposed to have no thoughts in a mindfulness activity. What we're trying to do is build your awareness of the thoughts. So we are using the wisdom traditions in ACT, and often that's people's kind of things that they're working on in between sessions, and I actually have audio recordings of some activities that I send to people to keep trying to work on. But because people have tried it and they think that they're no good at it, sometimes I just don't even use those words. I just kind of give them the experience of it. And ACT is an active therapy, so there's writing exercises. The therapy is full of metaphors and mindfulness activities, and it's not necessarily just a sitting and having it is a talking therapy, but there's lots of doing in it. So this is important if anybody listening has decided that they want to build ACT into their work with their clients or their people, their participants, is that it truly is the foundation of this is the relationship. It's a real relationship, and that's why I have real in caps there. You can't fake ACT. You can't use it like a toolkit where I'm going to do step 1 with somebody and then step 2 with somebody. It is a partnership, and if you decide to read any ACT resources, there's several chapters on, well, how do you build this therapeutic relationship that's built on realness. And we're not trying to say that the therapist or the counselor knows better. We're on an equal playing field. It is a true partnership. The people who you're working with, their goals are their goals, even in the back of your mind if you're thinking, wow, this doesn't make any sense. This is all stuff that social workers are always really, really good at anyways, that relationship and partnership and building an equal playing field where people are working together and clients are setting their own goals. And it is a therapy that if you're not practicing mindfulness and actually living in the moment, it's hard to be truly present with your client. I'm here in this room right now, and I'm practicing being very mindful about what it is that we're doing. I'm listening to my voice. I'm thinking about my body language. I'm trying to organize this material in a way that's compassionate and respectful to people that are listening. And if I was thinking about what I'm going to cook for supper tonight or what's going to happen tonight down the road, I'm not truly present here in this room with people. And so the ACT practitioner really needs to practice that authentic mindfulness and compassionate way of sharing information with people. And it's okay to be real with people and to say, wow, I have that stream of thoughts too. That's interesting. Me and you have that same value, or me and you have that same experience. Let me tell you a story about my ideas when I started to make a shift with this and how it worked for me. Because if you're not actually practicing ACT, I don't think you can actually do it with people. I put that on a T-shirt and wear it to the mall. I believe it to be true. Like, you could actually walk through the process with people, but ACT is a way of living. It's a way of you being aware of the relationship that you even have with your own thoughts. And some of the resources that I will share with you guys at the end, like there are books for practitioners, and it's helping you understand what ACT looks like and what it feels like. And we're doing our own homework. So, at the end of this, if there's some ACT practitioners that want to get together and have bi-weekly kind of supervision or meetings to kind of see how you're doing with your own ACT practice, then that's something that's really super important. I'm just about to start a supervision with a practitioner, world leader in Australia. She does ACT for adolescents, and we need to learn from people who are ahead of the curve of us, and also really be aware that sometimes we get stuck in thought patterns that are not very helpful when it comes to certain clients that we're working with, and how do we work through that. And ACT is a wonderful way of actually supervising teams of people, and it can be overlaid on a lot of situations. So we aim to breathe and live ACT ourselves if we're going to be delivering this to groups or individuals. It's not a toolkit. You can't overlay it. It would be wonderful if we just had a suit of clothes that you could take off a rack and just overlay it on everybody and say, this is step 1, step 2, step 3 of ACT. But that's not the way that it works. It's so individualized. That's the double-edged sword of ACT therapy, and the metaphor of double-edged sword is through ACT therapy, really. So, there's wonderful things about ACT, and you got to use it and work it in order for it to work. But the other side of it is that it's not an easy therapy to use because you can't use it like a toolkit. See what I did there? I just mirrored one of the ACT concepts, which is, things are not always easy. So ACT is one of these therapies that has been scientifically studied, and significant statistics to show that it's effective in a wide range of things. I'm not going to read down through all these because it's just going to be a waste of time. You guys see there's a lot of stuff. It's been proven to help with almost everything. And one of the things that I love about ACT therapy is the scientifically studied part of it. And the way that ACT has been around for about 40 years, and it's been researched from the get-go, from its development. And so pieces of it have been really micro-studied, and then it's been macro-studied, and some of the tools and techniques have been studied and thrown away because they didn't seem to work, and then they've been put back in. So there's an extreme amount of research that goes behind this. If you truly are practicing ACT and using it in its way that it was intended to work for people. ACT informed is probably what a lot of people are doing, just like some people have done CBT informed or we're trauma informed, but walking it out are different things, and that's when you start to see the successes, when you're actually walking it out. So this is one of the founders of ACT therapy. His name is Stephen Hayes. And he is a professor of psychology at the University of Nevada. He's written over 40 books. He's the co-author of over 100 scientific articles. He's been the president of some pretty high associations, behavioral and cognitive therapy associations, and contextual behavioral science. And he's also the developer of rational frame theory, and that theory really is the foundation of ACT therapy. So here's the thing. We're not going to talk about rational frame therapy here because it's very confusing and very technical. And if Steve Hayes was here today, he would actually say, or other people who are ACT world leaders would say, if you think about a car, rational frame theory is like learning the minor interactions of how an engine works. You don't need to know how an engine works to drive a car very effectively. So acceptance and commitment therapy takes the foundation of rational frame therapy and puts it into a user-friendly way of navigating the world. But with that being said, if you really want to know much about rational frame therapy and you're a bit of a nerd therapy like I am, or theory like I am, you'll find it truly amazing. So ACT has 40 years of, like I just said, of development, and it's been studied along the way, which makes it a pretty powerful type of therapy. And if you listen to any of Steve's commentaries about ACT, he often talks about the differences between CBT and ACT and the differences in how it was studied, and he's pretty passionate about how ACT is really kind of lifting to the surface even more than CBT, so I won't bore you with that, but that's something that he talks about in one of his newest books called The Liberated Mind, and it's a fantastic book. I've probably read it 3 or 4 times now, and I also have it on audio. I listened to it this morning when I was getting ready to come here, so he talks a lot about the differences in between. So there's been over 3,000 studies that back up ACT and the positive outcomes. And there has been sample size studies of over 10,000 people they've been following for decades. So this is not like a flash in the pan kind of therapy. It's been around for a long time. It has some really good solid research under it. And if you just Googled ACT and OCD today, you come up with hundreds of research about that. OCD is where I got my first introduction to ACT therapy. Was at an international conference for OCD, and people were starting to talk about it, and that was like 5 or 6 years ago, and I've been kind of surfing around trying to get some good training in ACT ever since then, but it's, if you Googled ACT in any kind of clinical area that you're interested in, you're probably going to find some really good numbers and research on that. So ACT is a wonderful example of using Western science approaches, like scientific methods, to help us understand how those Eastern contemplative practices actually work. So it's a good marriage between that. And it offers simple techniques that almost anybody can use. I used one of the simple ACT techniques the other day with a client of mine. She's 13 years old. She's having an extreme amount of anxiety. And we did this expansion exercise where, at the beginning of our session, she was like, I need a pill. I just cannot stop this racing thought. And I said to her, well, let's just try one thing first. And in 15 minutes, she said, that worked. I feel a lot better. So the techniques, if you're looking for, good resources, they're easy. Anybody can use them. Once you've practiced using them yourself, that's one of the core things of ACT is like practice the meditations, practice the scripts, practice what you're going to say in this counseling session that you're hoping is going to be intended on one of the core concepts. And really, once you start working it for yourself, you're going to notice it. And ACT is really moving into workplaces where, the Olympic athletes are using it. High crisis professionals are using it. Therapists, social workers, first responders, and medical professions. It's really seeping into there now, too. I had a conversation with somebody the other day who teaches at a private college, and she said that she's seen it pop up in the supervision of students in those places too. So it's interesting. So this guy, his name is Ross Harris, and he is from Australia. And Australia is doing some fabulous ACT work, and they're very progressive. Ross has written so many books. One of the books that he wrote is called The Happiness Trap. I often say to people who are coming to first meet with me, not to my adolescent clients, I know, but to my adult clients, to go pick up a copy of The Happiness Trap, because it really gives you a user manual for ACT that we didn't have really before he wrote this book. He's a physician, he's a therapist, a public speaker. He's travels the world teaching ACT concepts to people. He wrote these books. One of them is called Happiness Trap that we just talked about. ACT Made Simple is a book for practitioners to use. Just came out with the second edition of that book. If you are a practitioner and you want to start using ACT, I would highly recommend the ACT Made Simple book. He wrote The Confidence Gap and ACT for couples, ACT for relationships, you name it. He's overlaid acceptance and commitment therapy on many things. So if you really want a nice resource, find him, and he gives away a lot of free material too. And his team is who I did my acceptance and commitment therapy training with. So, in the beginning of the Happiness Trap, what he talks a lot about, and this is sort of the underlyings of acceptance and commitment therapy, is that there are a lot of, especially in our modern day world, a lot of marketing myths about happiness. And this is some of the stuff that creates the struggle for the human condition, is that we've sort of, human beings get this range of emotions to feel. Sadness, happiness, frustration, disgust, you name it. There's this wide variety of feelings. And in our North American modern day world, we've sort of done this thing in the self-help, pop culture, psychology world, where we've graduated happiness to be the best feeling. And we want to aim for happiness the best most of the time. And if I'm not feeling happy all the time, then there must be something wrong with me. When the reality is that happiness is not the natural, normal state for all human beings at all the time. This is some of the myths. We have to accept that we are going to feel feelings other than happiness. We are going to feel emotions that are connected to sadness and frustration. And every emotion that we're feeling actually is a message for helping us build awareness to what's actually happening to us in our moment, in our present-day moment at this time. And if we're fed to sort of the magic beans that you must be happy all the time. Happiness is the natural state of all human beings. If you're not happy all the time, you're defective. In order to create a better life, you have to get rid of negative thoughts and feelings and experiences. And also the other big myth is that you should be able to control what you think and what you feel. And if I got anything out of the differences between cognitive behavioral therapy and ACT is that, we do have to ride the waves of emotions and feelings and be okay with certain streams of thoughts that are coming to us. And we don't have as much control over our thinking as we would like ourselves to think we do. So one of the things that's wonderful about ACT therapy is that there's a lot of evolutionary psychology in this. And this also really mirrors some of the Shankar self-reg processes that I've been trained into. So we do have to have this understanding and acceptance that there are survival negative thoughts that are operating in our brain that are hundreds of thousands of years old. And there's no magic delete button for them. And if you think about us as cave people, and I use the word cave people in my sessions a lot with people, after we've talked about, well, why would it be so emotionally distressing to be dealing with rejection from your social group? Or why would it be so painful to be worried about what's going to happen in the future? It's because your brain is doing what it was hardwired to do. And I love the fact that we're all Newfoundlanders here on this webinar here today, because I think if you think about the history of Newfoundlanders, you'd only have to go back even just a couple of 100 years ago. Survival was not guaranteed. We lived in tiny outports, didn't have access to a whole lot of services or medications, or, people, even just a couple of 100 years ago, we had no electricity. We had no vehicles in here. We are still living just a couple of generations ago in a way that survival was necessary. You had to go around your communities, walk around and compare yourself to other people to know, am I doing well or not? And that is a modern day problem for a lot of us, especially now we have this technology of our smartphones, social media. We're comparing and contrasting ourselves to people all the time. At one time, you'd only have your your clan of about 100 people to compare and contrast yourself to. And now we have young people who are comparing themselves to the Kardashians, who are, a different part of the world than us. And so, we have these technology devices here now that really amplify compare and despair. And so what we're trying to do is trying to help people acknowledge that there are going to be streams of thought, especially around physical and social safety. Those are things that can really hook us up. And we are going to experience the desire to move away from pain and discomfort, because that's what the human brain did. The human cave person brain said, wow, that situation might feel uncomfortable, it might be dangerous, I should turn in the opposite direction. So we move away from pain and discomfort. And that's some of the foundation of addictions and other mental health concerns, is because we want to avoid pain and discomfort. So we're hardwired for these sort of watch out thoughts, and we also want to hold on to painful memories. So, a part of the brain that holds memories, and if we had a full day of ACT therapy, we'd have a picture of a brain up here, and we'd be talking about the evolutionary part of the brain, the prefrontal cortex of the brain where our logic lives, is not driving the bus. The fear center of our brain, our limbic centers, and a part of the brain that stores our memories, called your hippocampus, is like a jump drive, and it only has so much storage space. So, and it does that on purpose. It says, I'm going to store painful memories about situations because your survival depends upon it. So you might have had 100,000 memories of a dog and have all kinds of positive interactions. You get bit once or you get chased once, then you're going to remember that. And so the human brain does that on purpose. It highlights and lifts up painful memories because it thinks that that's the best way to think. We also think, the human brain also thinks that ruminating over conflicts and difficult times is the best way to think. Some of us get caught in rumination. Here's the other thing. We used to think that we thought, that whole paradigm of thought, feeling, behavior in the cognitive behavioral therapy world is really oversimplified. Because what we know now is that once there's an antecedent in somebody's situation, and that can be an external antecedent or a personal antecedent, a thought, or a situation, usually you don't think one thought. You think streams of thoughts. So once we start to figure out that there's usually not one thought or that's getting us hooked into feeling misery, we're way ahead of the game, because we can cluster those thoughts together and figure out how we're going to deal with those thoughts as a group, as opposed to just one thought and another thought and another thought. It's been really helpful to have that understanding that we think in streams. And some thoughts are conscious and some are subconscious. We have a huge desire to fit into the group. This is a big piece of the adolescent ACT work that I do with people. Physical, we feel rejection like physical pain. There's this underlying subconscious caveman, cave lady, cave person thought that rejection is bad, and we actually feel rejection like physical pain. And we compare ourselves to others. So these are the evolutionary psychology of our human thoughts. And these are the ones that we're sometimes just accepting that they are. And I have my first or second session with people, and I'm often talking to people like, well, let's just talk about the things that the human brain likes to worry about. And then we'll start calling those like cave people thoughts. And in our interactions with people, I'll say, hey, hang on now, it sounds like there's some cave person thought going on there. Do we really want to hook onto that, or do we just want to acknowledge that it's there and try to figure out how to deal with that? So one of the things about we're going to top it. Oh, I love this picture. So here's a cave person sitting in front of a computer, and some of our modern day technology in our modern day world is what's creating some of the distress for us, because we're comparing ourselves, or somebody is accessible to us all the time and we have to make sure we get back to people and all of that stuff. So here's what ACT thinks about thoughts. That let's move away from labeling thoughts as either good or bad. Let's just say they are what they are, and start to ask a question about the context of the situation. Is this thought helpful for me to think about right now in the context of this situation? So that's why ACT is considered to be a contextual therapy, because we do have to overlay context on situations and move away from saying that's a negative thought or that's a good thought. People who have experienced cognitive behavioral therapy, when they come to meet with me, are often really, really good at saying, well, I get hooked up into these negative thoughts. And really, I say to people, well, let's just stop saying that if they're good or they're bad. They just are what they are. But do you have an option to hook onto it right here or now? And how does that make you feel? Is some of the thoughts about thoughts in the ACT world. We need to overlay compassionate systems like being self-compassionate. Of course I would have that stream of thoughts. I'm a human being. And let's not sort of layer another stream of thoughts about there must be something wrong with me because I'm having this stream of thoughts. So overlaid on top of all of the ACT pivot points, which we're going to talk about, is this idea of compassion. And that's been scientifically studied, too, to show that we do need to talk about compassion. The question is, what stream of thoughts do I want to hook onto right now? There is no really control over thoughts. What we can do is sort of build our awareness of what the thoughts are and what they're there for. And our minds are also wonderful storytellers, and it also is a wonderful reason-giving machine. So I actually have a Tupperware container in my office that is I pretend it's the brain, and we say, here's the reason-giving machine. And there's some pretty common denominators of the human experience as to why we try to talk ourselves out of situations. And people just pick out, oh, yeah, I have that thought. Oh, I have that thought. And so we really have to think about the brain as a machine that pumps out thoughts, and it does it no differently than our heart pumps our blood in a certain direction. We can't get mad at our heart because it's doing its job. Our brain is doing its job. So how do we train ourselves to just be smarter and more aware of what's happening for us? I'm just noticing the time. And we've got a lot of material to cover here. So this is what we think about our thoughts as human beings. We think that our thoughts are truth. We think that they're reality. We think that they're important. We think that we need to take them seriously. We give our thoughts a lot of attention. We follow the orders of our thoughts. And we assume that our thoughts know best. But all of that is sort of not true when it comes to the ACT world. We're trying to help ourselves be smarter than these thoughts. And I don't have this on a slide, but I just want to say, our human brain will pump out 90,000 thoughts in the run of a day. How are you supposed to listen to all of those? So we really want to focus on the thoughts that make sense to focus on right now. And some of those thoughts are going to be, what am I going to have for supper? What time do I have to get out of bed in order to get things done? And those are sort of conscious thoughts about what's going to happen in my day and all of that stuff. But then there are some subconscious streams of thoughts that really block us, like worthiness and can I actually do this? I'm not important enough, or the value of myself leads in there as well. But just because you have a thought doesn't necessarily mean that it's true. You don't have to believe everything your brain pumps out, which is a real shift for people. We're not actually going to do this because I think we're running out of time. But if we had a full day to do ACT therapy, we would actually do this. So you just sit and you think about something. I use an apple because I think apples are important for people. So to set this operational up, you'd say, think of an apple and don't think about anything else. Think about this red, juicy apple and sit there, close your eyes and think about that apple and time yourself for 1 minute. What you would notice is that your thoughts would go everywhere. This is just a little activity to show that we really don't have as much control over our thoughts as we thought we did. I do that with my clients too. I usually use ice cream because ice cream is hard to not think about. So part of the philosophy and the theory with ACT therapy is that it is a natural human experience to move away from things that are going to cause us pain. So this is where it gets curious, and this is how ACT actually helps people with the motivational things. You think about well, I've always wanted to do this thing, but I won't do it, or I can't do it. And ACT has an answer for that, and that is this experiential avoidance. It's a human characteristic of moving away from things that cause us pain. And it's breaking through that avoidance sometimes is where people really get their great gain. So sometimes, part of the ACT assessment when you're meeting with somebody, when you're getting histories from people, is to kind of highlight where the avoidance is happening. And that is a big part of the case conceptualization, which we don't have time to go into today. But if you have somebody on your caseload and they are dealing with addictions issues, gambling, alcohol, drugs, smoking, lack of exercise, like any of those things that we like, a lot of people say, well, geez, I know I should be doing these things, but I just don't know why I'm not doing them. Some of the experiences in the ACT world can be really helpful for that. But we are in an assessment process trying to figure out where people's experiences of avoidance are. So this slide just says exactly what I just said. We really can see like where people are stuck because the avoidance comes in, and it's a normal, natural thing. Of course, I want to avoid pain. So like if you think about from an alcohol use, if somebody has a trauma history, alcohol is very effective at numbing experiences and helping people feel like they're having a way to sort of de-escalate or rewind or not, totally avoid. It's alcohol. People will drink to the point where they totally just black out because they want to avoid. And after a certain period of time of that, practicing in that direction, it's about, of course you wouldn't want to feel those feelings. And it might actually be a very effective tool, to keep you from avoiding. So here is, for the rest of the time, in the 20 minutes, we're going to take a slide or a couple of slides and talk about each one of these, Steve would call these pivot points of ACT. So at the top is contacting the present moment. Next on the other side is chosen values, committed action, self as a context, thought diffusion, and acceptance and willingness. And in the beginning, it's not easy to know where to start because this is an individual place. This is individually for everybody. But what we know is that this is the sort of crib sheet, I guess, for your therapy sessions with people, and to try to figure out like what session, you might have an idea about, I'm going to go into this session with contacting the present with the understanding that you might not get there. You might have to pop over to values, or you might have to go somewhere else. When these are all working in together, you get that diamond in the middle of that psychological flexibility. And psychological flexibility just, it means that you're actually in your present day moment, you're open to the experience that you're having, and you're actually going to do what matters to you. And like I said, there's no right or wrong way to start here, but I like to start, generally speaking, with contacting the present moment. So that's probably going to be the first slide for here, and using some mindfulness tools in order to help with that. The reason that I like to start with contacting the present is that not only is it one of the core values of ACT therapy, but it's also a great de-escalator if somebody is heightened really emotionally. And so there's some activities called like dropping an anchor and things like that you can do with people. Because what you're trying to do, before you can do any talking therapy with somebody, you have to deactivate the fear center, deactivate the emotional center of the human brain, and kind of pull them up into their prefrontal cortex, because this work is logical work. And if you're afraid, if you're scared, if you're overwhelmed, then you're going to hop over to chosen values, and people are going to pull you back because they're not grounded in their present day moment. So that's just my personal view, is to start with contacting the present day moment, because people are often coming to us because they are experiencing on a regular basis a lot of emotional flooding or emotional dysregulation, and they can actually get a tool on session one to go home and start practicing. So that's just my idea with that. Some people who you'll be learning ACT from will be saying something different. That's just been my experience. Oh, this is the other thing I would say. I never take out this diagram and explain ACT with clients with this diagram. It's just too much. It's too much jargon. It's too much. Now, if somebody was far along in their sessions and we were, really talking a lot about ACT and we're walking through the Happiness Trap book, I might take it out on a day when something went really well and say, look at this. You hit every single one of the pivot points on this scenario. and all of your progress with the psychological flexibility happened because you did all this. But I would never use this in intro sessions, and probably shouldn't have used it today either. But anyways, we're talking about theory, so it makes sense for us to look at that right now. So contacting the present day moment, I'm not going to read all this out. I'm just going to talk about what it actually looks like on real time. So contacting the present moment actually means, like, are you here? Are you now? Are your thoughts right here, right now? Are my thoughts here in this office at the Social Work Association looking at Annette across from me? Or am I somewhere else? And the human brain does not want to be in the present day moment. It actually thinks that thinking into the future is the better way to think, because safety is just around the corner, or something unsafe is just around the corner, or an unknown is around the corner. So it's very hard for the human brain to stay in the present. So we do that on purpose because of a primitive way of thinking, which is called orienting. So if I'm thinking about past situations that happened to me, and I'm overlaying it on a current situation, and I'm forecasting into the future something that could possibly go wrong, that's not a good or a bad thing. It just is. It is what it is, and that's the way the human brain wants to think if you just sort of let it do its thing. So we have to kind of train our brain to say, it's okay, come back now. It's okay, come back now. And that's where the modern day I guess the idea of using some mindfulness techniques and strategies comes into, because quite honestly, that's really what mindfulness is about. You're aware, oh, I'm not here with Annette. I'm thinking about the yoga class I'm going to be teaching tonight. I got to come back here. But of course, compassionately, you come back to the present day moment. I don't want to get into this cognitive script with myself of how stupid I am because I can't be in the present day moment. I want to be compassionate about the fact that my brain is on automatic pilot, and I'm just kind of out there, wavering around, right? So are you really consciously here right now? And you can imagine how great that is if you're doing one-on-one work with people. You really got to be there with them at that moment. But to be okay with the fact that you are going to move outside the context of the present moment, because that's what the human brain likes to do. Here's the thing. Accessing the present day moment is difficult because of this whole idea of orientation for the human brain and how it wants to know where it came from, where it wants to go. But the thing is that it provides this reorientation out of the present day moment, because we get caught in these cycles of thoughts about the present moment is not the best place to be. So every time we catch ourselves thinking in a certain way or moving in a certain way, and we can passionately say, just come back to now, we're actually encouraging psychological flexibility. But one of the other things we're doing is we're creating a new sense of neuroplasticity. So, years ago when we used to say, the brain is hardwired, it is what it is, this is the way the human brain is, we'll be able to give you some medications or coping techniques in order to deal with whatever mental health concern you're dealing with. We really didn't understand the whole idea that the brain is very plastic, that we can actually rewire the brain in a way to think in new ways. So contacting the present day moment gives people a lot of exercise into, and every time you catch yourself thinking in a certain way and you come back, you are actually going to the gym for your brain. We can do brain scans now and watch people rewire their brains. There is no magic delete button after a stream of thoughts has been laid down. So if you have a stream of thoughts that are very like a phobia-based thought or an anxious-based thought, when stress levels are high, we're probably going to jump back in there again. And so we got to be able to kind of lift ourselves up and get into new streams of thoughts. And the way to practice and practice and practice. ACT therapy never goes away. Once you start using ACT therapy yourself and you start practicing it yourself, you're going to realize that there's no checkbox on this that says, yeah, I got ACT done, put that in a little box, put it away. You're always just trying to take things to a deeper level. So contacting the present moment is a very important part of this. And this is where mindfulness practices come in, like I was just talking about. So our brain is usually full of a lot of things, but what we're trying to do is just narrow the focus down to what's important to you right now, here in this context of the situation that you're dealing with right here and right now. And if we actually had time today, I would walk you guys through a grounding activity that puts you back into the moment of the present day moment. I don't know if there's a way for us to give people extra information, but I have after people have done this, but I have an audio tape of a tape now, just saying how old I am. A recording of a grounding activity that's called dropping an anchor, and if people are interested in that, I'll maybe post it somewhere on my Facebook feed so you can actually listen to it and start practicing it. But the best moment to be is always now. This is where you have your most power, is in your present day moment. So another one of the pivot points is called diffusion, and this is a totally made up word. If you Googled or went to the Webster's Dictionary and tried to find diffusion, you wouldn't have it. You wouldn't find it. Maybe it will be there eventually down the road. But it is a word that the ACT founders decided made sense. So diffusion means, can you actually step back and separate yourself from your thoughts and the images that you have in your head and your memories? So fusion is, the thoughts are so close to me that there's no space between me and the thoughts. And you'll know fusion when you see it, because people are really overwhelmed. They're crying, they don't know what to do, they're really upset, they're feeling really stuck, they're not understanding what's happening, and if you try to go into another line of questioning and they just keep coming back, there is fusion happening. And helping people understand that they can build some space between them and their thoughts. And this is another one of these ancient wisdoms, which is, are you really your thoughts? Anybody who's interested in Eckhart Tolle's work, if you've read The Power of Now or any of his teachings, that's some of the core stuff for him is like, you are the watcher of your thoughts. Who you really are is the watcher. You're not necessarily your thoughts. And that's a hard pill for a lot of people to swallow at the beginning of this. So I don't go too deep into the philosophical ancient wisdom of this, except for to help people understand that they can stand back and be the watcher of their thoughts. And there's activities that help people do that. And it's really an important, so when you're working with somebody, the language that you would be mirroring is that, like, this would be an example, like, I can see that you're thinking this way, or if I was watching you, let's just say there was a video camera in your bedroom last night when you were really upset, and there was a machine that could put your thoughts on the bedroom wall, what would we see? Like, what kind of thoughts are your brain pumping out about this situation? And so we're really trying to role model, and even if, like, you might even be using your own self as an example, it's like, well, last night I had an email from a friend of mine, and she wanted me to come over for dinner, and there was somebody over there that I didn't really want to see because maybe I dated them in the past. My brain was pumping out all of these thoughts, so that you can, like, mirroring the fact that, we can't be the watcher of our thoughts is a really great way to do this. And ACT is all about role modeling the fact that, oh yeah, of course that we can. And so there are some techniques of diffusion, and Ross Harrison, The Happiness Trap, does a wonderful job of helping people experiment with diffusion activities. So when you're paying attention to the moment, you're able to detangle yourself from the web of your thoughts and emotions. So this is an example of how mindfulness, accessing the present day moment, and thought diffusion really work well together. Sometimes just saying, wow, that's interesting, look at me thinking that thought is enough to process diffusion, which is a wonderful thing, and once you get practice at it. I had to practice that over the weekend with a situation that came up in my life that brought me back 15 years. So this is an example of fusion and diffusion. So fusion is being in your thoughts. You can get bounced around in the water when you're in your thoughts, especially if it's a windy day out on the pond. It's hard to swim, right? And observing your thoughts and sitting in your canoe and just looking. So you can hover over the streams of thoughts that you have. And this picture, I love this picture. I have it on my clipboard in my office, and I show it to everybody. This is an example of a thought hook. And so when you're fused to a stream of thoughts that's not helpful for you, given the context of how you want to feel and what's important to you, quite often I'll break out this picture too. It's laminated. and we can actually write on the thought cloud the thought that I'm having. Well, I'm stupid. I can't do math. Or everybody hates me. And then we can talk about, like, well, what happens to you when you do get hooked on this thought. So this is just another example of, like, real hands-on activities that you can be doing with people to help them create some space and distance between their thoughts. So here's an example of diffusion. So lots of us will say, oh, I'm anxious. When one more step away from fusion is on having some racing, anxious thoughts. That's one step of separation away from I'm anxious. And a really nice diffusion place to be is I am noticing that I am having racing, anxious thoughts and sensations. So I sent a little ACT joke to a friend of mine today. She understood what I said. I'm on my way to the Social Work Association to do this. I'm aware that I'm having anxious thoughts about this presentation. So it happens in real life, right? So you can move from, if you have a thought that I'm anxious, you got nowhere to go from there. So creating space between you and your thoughts can be really helpful. This is an example of an activity that I do with everybody. I learned this activity, it's called a choice point. I learned it from my training with Ross Harris and his team. We don't have time to go through it now, but it really is a way, this is a piece of paper, and you write on it, you get messy with it, like, what would be the benefits of getting hooked on? And so you write down all the benefits of getting hooked on, sort of on that section of the paper that has the away section on it. What would be the benefits of unhooking? And so you really help people, because believe it or not, there will be pros and cons of hooking, and there'll be pros and cons of unhooking. And you got to help people kind of walk through a thought process. Again, we're not naming any thoughts as good or bad. They just are what they are. This is a powerful diffusion technique, and once you write it out a couple of times with people, you don't actually need to do the writing anymore. You're just sort of saying, like, well, are there any benefits of hooking on here right now? And maybe there are. So, we process through that. So one of the key points is acceptance, which really means opening up. And this is where we struggle a lot, because the opposite of acceptance is avoidance. And so in the ACT world, we're actually helping people name their feelings, name the sensations, talk about it's the struggle with this avoidance that might be creating some of your distress, and the acceptance and opening up and actually leaning into some emotions that you might not want to feel is really super, super powerful. And there are, again, lots of activities that you can start practicing around the acceptance of opening up. And some of them are things that people probably do already. One of the basic ones would be, well, where do you actually feel that feeling in your body? Often, most people will say, I get it right in my belly. Some people will say, I got it right in my throat. Some people say, I get it right in my head, which is really interesting to me because it often mirrors the chakras. If people are understanding chakras in the yoga world, will say, like, well, of course, we got to loosen up that chakra a bit because that's where, the distress is coming from. But if somebody says, yeah, I can feel it in my stomach, so then we're really leaning into it. And it's very important for us as social workers to not be afraid to lean into difficult situations with people. I mean, it's one of our superpowers, right? Like, we are there with people during difficult times, but quite often, sometimes and even in the CBT world, we're like, well, where that thought is negative, change it. When we want to lean into it, we want to process it. So it's like, what color does that thought have? What feeling does that? Where is it in your body? So you got it in your stomach. Does it sit on the top of your stomach, or does it seep into your stomach? If it's on your shoulders, is it on top of your shoulders and up the back of your neck, or on your shoulders and down your back? Does it have a vibration? Does it have a voice? Does it have a temperature? Does it have and you lean in and you lean in and you really identify what that physical sensation feels like. And after you've got that grounding of what that feels like, then there's another step in the process, which is just breathe into it. Just breathe into it. And let's thank your nervous system for giving you this ability to be afraid, because in another situation, this would get you out of a dangerous situation. Let's thank your brain for thinking this way, because your survival could depend upon it. So you don't fight the feeling. You acknowledge it. You give it all kinds of descriptions. Sometimes we're drawing it out. Sometimes we're painting it. You really want to lean into the feeling and accept that it's there. Because 9 chances out of 10, the emotion that you're having about a situation, I'm always saying, of course, I'd be frustrated too if this was happening to me. The trouble is that the avoidance of it makes it bigger. The avoidance of it, it's going to come back. An emotion like something that's really, really powerful, unprocessed, will come back. So once you process it a couple of times and give people that tool, they can do some of this themselves. So here's a little slide that talks about, emotions are not good or bad. They're signals. Our body's, telling us something. What's your feeling trying to tell you? Put a name to it. And this is very counter to what we were probably taught, depending on where you were raised or the school that you went to. When we were feeling distressed or stressed or sad or angry, somebody said that's a bad feeling, don't lean into it, and actually you should best just go listen to something that's going to make you feel better. Or they said, in a way that tried to help us, why would you feel that? Sure, don't feel that. And then we sort of subconsciously have friends with certain feelings, and we create enemies to other feelings when they're not either. They are what they are. And so we're trying to help people have some emotional literacy. It's one of the superpowers of acceptance and commitment therapy. So here's another slide that just talks about some steps, which is like turn towards it with acceptance. Identify and label. Accept that it's there. Realize that it's not going to last forever. No feeling lasts forever. If somebody came into your office now and told you a hilarious joke, you laugh at it. You might go off and tell somebody else about it, but in an hour's time, you wouldn't be cracking up unless it was like really super funny. But every feeling, every emotion is impermanent, and even your happiness is impermanent. And we kind of just got to just be curious about why it's there, and then kind of let it go. So you can't stop the stress in our lives, but we can learn to surf. And so John Kabat-Zinn, who is a world leader in building mindfulness in hospitals and universities and stuff like that, this is one of his famous quotes. We're going over. Okay. So 4 is self as a context. And this really means pure awareness, which is like I'm aware of myself. I'm aware of what I'm thinking. I'm aware of where I am, what I'm doing, what I'm thinking, what I'm feeling in most moments. And one of the beginnings of practicing self as a context is it's hard for people because people don't necessarily, if we lived in a different part of the world, this would be taught in our school settings, Stand outside yourself. Watch what you're doing. I always use hockey as an analogy for this. It's like on Saturday night when it's Hockey Night Canada is on, you could be cooking supper and listening to the game and know exactly what's happening. Because the commentator is saying, such and such has the puck now, and he's passed it to another person, and if he scores this goal, this is going to mean that it's his 3rd hat trick for the season, and they know all the stats and all of that stuff. It's amazing what they know. You know everything about you, too. And you can stand outside of yourself and use this self as a context and say, oh, there goes Lori, hooked on to this stream of thoughts that used to get her in trouble. Now, where do you want to go with this stream of thoughts? And this is what will happen if you go down this way. This is what's going to happen. And you get a choice. That's what the choice point activity is about. Like, where do you want to go? What's important to you? And you can make adjustments with this pure awareness of here it is that I'm going. And quite often your body gives you the understanding that that's where you're about to go because you feel it in your body first. Then the cognitive script comes. Then we get hooked. And then we're down, we go down the road, right? So you can, when we practice stopping and pausing because we're watching ourselves, and eventually people get this other side of the self-context, which is, wow, look at me operating in a different way. Before, this used to be a major trigger. I didn't even know what it was about. And I'd go down the rabbit hole, and then we wouldn't speak to each other for days or whatever the context of the situation might be. Or I used to be really scared in this situation. Now look at me, I'm doing it, and I'm having a reaction, but I'm using tools in order to help me in order to do that. So you can use the self as a context to kind of. I had a meeting with a woman the other day who said to me, I had this situation happen, and I stood in my living room, and I saw myself go to the couch, sit there, and cry for the rest of the day, and just not get anything done because that's what I used to do in the past. Saw it happen. And then I made a different choice. Cry, do what you got to do, then you got to get on the phone and you got to figure this out. How are things going to get done if you sit on the couch and do what you used to do? So that was her using this self as a context because she pulled out a value. The thing that she was going to avoid was so important to her, she wanted to get it done. And her recovery was big. So, you can stand outside and watch yourself. So, do you see yourself time traveling sometimes? I see myself time traveling all the time. But can you be the commentator on your time traveling? So, here we are, living in the present day moment, but we're thinking about the past or we're thinking about the future. And can you watch yourself and check on those thoughts that are pulling you out of your present day moment? So this little image is a wonderful example of how you use mindfulness, the idea that our thoughts are going to move time, and self as a context at the same time. So that's, we're talking about these individually with the understanding that we are going to think in certain ways. So pivot number 5 is values. It's like knowing what matters to us. The values piece, I think, is so important. So I ask people sort of at the beginning of our sessions and as we get into it, like really deep in your heart, what matters to you? And even do a time travel question, which is like, at the end of your life, like what do you want to stand for? What do you want to do? Do you want to travel? Do you want to have a big family? Do you want to have, and sky is the limit. What is it that you want to do? Because quite often, human distress is because you're living out of alignment with things that are super important to you. And also, if you identify the things that are important to you, even in the midst of some pretty big crisis situations, you still get the option to have some joy and contentment in your life. Crisis and trauma can coincide with having fun or being there with your family, whatever it is your value card happens to be. And there are assessment tools for kids, for adolescents, for adults that actually will help people understand and really lift up what's important to them. And almost everybody that I meet with gets a value session when the timing is right. This is where it gets kind of mixed about like what pivot point to start with. If you're working with somebody and that starting in the present day moment is really difficult and you're not seeing much movement, then I hop to values. Because values can be great motivators, and people get a lot out of the value activities, and they're not boring. I've got these trays of cards with activities on them. Right now, I just got somebody to paint a bunch of beach rocks for me that have all the value cards on them, and it can be super interactive. But a lot of really great questions come out of doing the value work, and it really can be the missing motivational piece that you're wondering why. Gosh, I know all this information. Why can't I get this done? It's usually because we need to do the values work. It really gives direction and motivation for the rest of the work. So here is a one card that came from. I have a deck of cards that are about ACT therapy, and here are some of the general life domains. So this is some of the stuff that's been studied around, like what do people find important. So there's families, parenting, partner stuff, and usually, conversations about what's really important to you. But this is just an example. Like, if health is one of the things that are really important to you now, so like maybe you got a diagnosis of diabetes or something like that, you really need to focus on your health. Like if you think about, the reasons why this is important to me, it might be the motivator for you to do a sugar reduction or get out of bed and go for a walk. If you really kind of drum up the value card, and this is a really neat picture to show how this works. So here we are in our boat, trying to go in a certain direction. And so here you are, your action plan, because we all have plans for therapy for people. And the values are up on the clouds. Like if you don't have any air in the atmosphere when you're trying to be in a boat, you're not getting anywhere. So your values are really what's kind of going to propel you into the direction of what your goals are. So it's never too late to choose or steer a new course, or to choose, your values that really help you take action. So I love that analogy, and I have that one on my clipboard too. It's like if you could actually put the things that are important to you in those clouds, you can see things happen. I personally have been doing writing every morning about certain values for me, and it's been super, super helpful. So here's a stream of questions that you might just generally ask people, but if you didn't want to actually do one of those inventories about values, like just asking people, like, what really matters the most to you in your life? How do you want to live your life? In other words, if somebody were to describe you and your ideal life, like, what do you want? And putting those things on paper, and especially doing free writing about that, like set a timer. Who cares about the punctuation or the spelling? It's just like write about that. Or you've picked a value, like fun. I need more fun in my life. So then, let's just write about fun, why you want it. When you don't have it in your life, what happened to you? About a time in your life when you had it in your life and what it did for your life. So a lot of free writing and the values and activities can be really helpful. I love this. This is Dr. Seuss. You have brains in your head and feet in your shoes, and you can steer yourself in any direction that you choose. Dr. Seuss was a genius. So, 6. We're almost at the end of it here. 6 is the committed action. So this really means, like, what are the things that you're going to do to work towards the things that you want? And just wanting them to happen is not going to make it happen. I use Michelle Obama as an example all the time. She didn't get those really toned arms just because she wanted them, right? she had to do the push-ups. I'm pretty sure that there's a push-up in there somewhere for her, right? So what is it that you need to do in order to make this happen? And we always have a question about what actions are you going to take in between sessions. Like, what does it mean? Like, what are you actually going to do? And so in the committed action world, it actually might mean that this is your exposure therapy that you're going to do if you're living with OCD. It might mean that you're actually going to try to work out 3 times a week, or you're going to go to a yoga class, so we've got some subcategories in the committed action world too that are scientifically proven to work. Like if people understand, like, how do you set SMART goals as opposed to just like a goal that's really, probably not going to work, those fit in there. And sometimes the committed action is actually learning a new skill. So things like more assertiveness stuff, or learning how to step outside your comfort zone, or time management might be a skill training or something like that. So the committed action is where the rubber hits the road. And it's very much guided by your values and things like that. And that's the doing piece. So the psychological flexibility is how everything fits together. Those 6 core facets, they work together to create the psychological flexibility. And, in a nutshell, what it really means is, are you present? Are you open to what's happening to you right now? And are you doing what really matters to you? Technically speaking, that is sort of the primary aim of acceptance and commitment therapy, is to create this psychological flexibility in your world. And what we know is that from the research is that if psychological rigidity equals high levels of anxiety, high levels of depression. We know that if people don't care about much in their life, if their value levels are low, there's more chance that they're going to have anxiety or depression. So some of the science behind this is pretty clear about why and how we would move forward. So I'm going to stop there because there might be some questions.
Yes.
And we're way over our hour.
No, we're good. That's excellent. Thank you so much, Lori. So we will take some questions now that have been coming in. So the first question is, what if a person identifies a value that may not be within their control? Example, identify family, but their family is detached from them in a very clear way. That may not change.
Yeah. So their value, if I read this right, if a person identifies a value that, so maybe family is a big value for them,
Yep.
and that's not going to happen because they're disconnected or detached from their family
Yep.
for whatever reason in a very clear way. So I would also say acceptance is a part of this. So like there are lots of things that we have zero control over. I would also be saying, validating that is a very painful situation to want family and then not have it, because it's psychologically rejection, and you're going to feel a lot of feelings around that. There's going to be a lot of pain around that. So we'd have to pick away at the acceptance piece, and that if family is a big value for her or him, or whatever that person, then to identify, well, maybe is there a way to explore how to get those great things that you get out of family maybe somewhere else, if you're not going to necessarily get it from family. But that would be a very difficult situation from a psychological perspective, because that is not what the human brain wants. Connection to family is psychological safety, right? That's your genetic code, that's your kin, and from a psychological perspective, acceptance means safety. And so when we're rejected, that is very, very painful. And there are maybe some other things that this person might have control of, which is other fantastic people that they bring into their life. But that's just at the beginning. But that might be a short answer.
Yeah, no, that was an excellent answer. Thank you so much. The cards that you were talking about in terms of life domains, did you create the cards by yourself, or did you purchase them somewhere?
I purchased a set, and I didn't like them. So then I made my own set. So it's not that I didn't like them. It's just that they didn't flow for me. So I actually have my own cards that I made out of different color construction paper. And I have several decks of cards that I bought, and I like some of them and some of them I don't like. But the ones that I made myself are the ones that I really love. And you do the activity on a big table. You got a lot of room, and there's probably 20 cards, and you put them in sorting piles. And at the back of each card is a stream of questions to ask. But you can actually go on Russ Harris's website, and he'll give you forms that you can download that are part of the cards. But I begged, borrowed, and steal, and kind of created my own that flowed for the way that I work with people. I did have a picture of my cards in this presentation at the beginning to show you what a sorting kind of looked like, but I took it out. But you can buy. There's not a whole lot of them for sale in Canada. I had to buy my act from Russ Harris's from a UK site. So,
okay.
But there is a really progressive social worker in Ontario who has a deck of ACT cards, and I bought a couple of his books as well. And they're good. I like them, but I don't like them as much as my own.
Right.
Yeah.
That's fantastic. Another question is, how do you approach individuals who have trouble identifying values, i.e. those that feel nothing is going well for them?
Yeah. That's a tough one. I think that if you had the cards there with you and did an activity, quite often at least one will surface, and they don't have to be like, some of the scaling questions on the scientifically proven inventories for values actually asks people to rate them from, so family 0 to 10, health 0 to 10. And I did that activity with a very smart person the other day. And she said to me, I'm having trouble rating them. I don't want to give them a number. And I said, okay, don't give them a number.
Mm-hmm.
Let's just put them in a hierarchy. And then that sort of and then when the one that floated on to the top, I said, well, let's just talk about this one.
Okay.
So the values work is really like, well, what's something that you have a little bit of oomph about? And but maybe you're not doing anything about it. So first the values is which ones are important to you. And then the next question is, well, if family is really important to you, what are you sort of doing in your present day moment to foster family? Well, I'm not doing anything. So some of the committed action then might be, well, I'm going to call my mom, or I'm going to email my brother and see what he's doing, because that's important to you. You might have a more rich, fulfilling life if you're reaching out and doing things. But quite often, if you're doing the activity, like an actual activity, something might surface. And if really nothing surfaces, I don't care about anything, I would just pick away at the other pivots first, and then kind of be making a mental note about information that comes back in your check-ins. And somebody might say, well, I had coffee with my friend or something like that. Oh, so tell me more about your friend, and what do you like about him, or what do you like about that person, or whatever. And you're almost always got this inspector hat on of trying to figure out, and then you'd make a little note about, well, maybe that is a value, right? So, but if somebody has no value, and it happens, then that's the sign that they're probably, really not doing well.
Another question, what aspect of the approach do you find people have the most difficult time with, and how do you work around some of that?
It's very individualized, and I'm not trying to not answer the question, but I would think the diffusion piece for a lot of people is really hard, because it's a hard pill to swallow that you're not your thoughts. What does that actually mean? If I'm not that, then what am I? And people kind of don't want to dive into that too much.
Yeah.
And that's a little bit of a philosophical jump and a leap for some people. So I think the self as a context and the diffusion sometimes is hard. And the value work is hard for some people too, because it's very painful to talk about stuff that's important to you, right?
That's right.
So you might see a lot of tears, and I even say to myself, like when I'm doing my values writing, because the year of 2020, my intention was to get really good at the values work, so I'm committed to doing that. So like, even as you're writing about something that's really important to you, that you love, you could be crying. So the sort of the mantra sometimes of the ACT world is you hurt where you care.
Mm-hmm.
And so sometimes the value work is hard, and we say to people, like, dip your toe into it and come back to it, and that can be emotional. The value work can be emotional.
Yeah. Excellent, thank you. Someone just writing in, they noticed that there's books for adolescents. Are there books for 8 to 10-year-olds as well?
Yeah, I'm sure you'll find them. The ACT work that training that I did with Russ Harris's team was for adolescents, and it was from 8 and up. So, the activities are not so cognitive. There's a lot of activities, like the mindfulness activities are like, I've always got a big roll of like packing bubbles and candy in my office, because we're like, mindfully, what does that jelly worm taste like? You're using different, and you're using music as mindfulness as opposed to some of the meditation. Like, next time you come, you bring your favorite song, so we're listening to it. We're going to listen to it without and if your thoughts wander, then we're going to, come back to it, and things like that. I'm on a couple of closed Facebook pages with ACT practitioners, and just last week, Russ Harris posted in one of the Facebook pages a new piece of research, shiny new, about new scientific research for ACT with children.
Okay.
So, full disclosure, my sweet spot is 8 and up, and even 8 is not, is something that I find I can do, but it's a very, I think it's a skill set that's necessary for young people, and when people come to see me age 10 and up, like, that's in my wheelhouse. But to give you any feedback on under 8, it's not something that, but I'm sure if you search for it, you'd find it.
Yeah.
I'm sure you would.
Excellent. Someone asked how they could use this material to assist with clients, I guess, that they're case managing.
Yeah, that's an excellent question. So I was just doing a little bit of research myself on how do you use ACT in brief therapy, which is not anything that I know much about. But I'm sure, again, if, role modeling, again, like, wow, this sounds like it's really hard for you, I'd be upset if this was happening too. Like, there's a huge piece, and I don't have to tell this to social workers, I often have to tell it to other clients that are populations of people that I work with. Like, just there's a huge amount of calming of the nervous system that happens with acknowledgement, right? This is really hard, I've got no control over this, or if this happened to me, I would feel that way too. is there anything that I might be able to do that could be helpful, and do the acceptance piece and the role modeling of, I would be really upset about that too. And the nuts and bolts of using it in a brief way with people is not something that I totally want to say I know, but I would just go back to the role modeling of it and acknowledgement.
Right.
Yeah.
Okay, excellent. Another question is, you mentioned that if you're not practicing ACT, you can't do it with others. Does this mean there's more self-disclosure involved in sessions?
Well, yes and no, because obviously there's a fine line, right? Like, I would never have a conversation with my client that, well, I just had the biggest argument with my husband today, and I had told him to go to this. That's not, you wouldn't be disclosing that. But there is a level of necessary disclosure of, like, if I have a client who I said, like, you write down all the thoughts you're having about this situation, and I'm going to write down all the thoughts that I'm having about this situation, and I'm usually truthful about it.
Yeah.
And then we look at it, it's like, no, your thought is the same as mine here, and we do some of that. So there is a place for disclosure. Oh yes, I think that way too. I have had those thoughts before in the past. I used to get hooked onto this thought. Is necessary, but of course you're not going to be saying, really in-depth self-disclosure thing, which, and again, as social workers, we contemplate the ethics of all that all the time, about how much to disclose, what would be helpful or not helpful in this situation,
Yeah.
That goes back to our ethics, yeah.
Excellent. Thank you. And last question, because we're almost at the top. Someone who's registered for the session and couldn't join because of a work issue that came up. In terms of, can ACT be used with, for example, DBT or other treatment modalities? What's your thoughts on that?
I think it certainly can, and I think if anybody who is familiar with DBT and watched this presentation would say, sure, I know about that because that's just DBT, because they do mirror each other a lot. So yeah, I think it definitely can.
Okay.
Yeah. I've moved away from DBT. I used to use it a lot, and I used to study it a lot, and very complicated. And so the ACT stuff philosophically really fits for me, because I was always looking for the reasons why DBT wasn't working, because DBT doesn't work for everybody, right?
Yeah.
We always knew there was a certain population of people that DBT was not working for. And I always, because of my yoga training and because I've been studying the works of Eckhart Tolle for a really long time, I would be peppering in that stuff anyways with the CBT, and it was, I guess, more of a mindful-based CBT. So I find that the activities and the homework and the metaphors and just the realness of it is a lot easier than CBT. Yeah.
Okay.
Yeah.
Interesting.
But definitely can mirror and overlay for sure.
Yes.
Yep.
And people will see that there's lots of some resources that you provided for people to go in and look at more information, your website as well.
Yep.
I mean, I wish we had more time because this has been so interesting, and some really great questions that have been coming in. Unfortunately, we are out of time, and I want to just thank Lori for this stellar presentation.
Oh, you're welcome.
It was truly stellar, and for sharing your knowledge, experience, and expertise with us today. You certainly covered a lot of information, and we hope this really sparked an interest in people learning more about ACT for their professional practice, but also for their personal lives.
Yeah.
It certainly sparked my interest. I know I'm going to be reading some more on this, so this is excellent. And as social workers, we're always looking for these opportunities for lifelong learning, and of course it would not be possible unless social workers like yourself, Lori, came forward to facilitate these wonderful education events for members. So truly, thank you for doing that and taking time out of your busy practice. I'm sure you must be so happy with the work that you're doing, because the passion really came through in terms of the work that you're doing. So thank you for doing this webinar for us.
You're very welcome.
Today. Just some housekeeping final comments is that the recording of this presentation will be uploaded to the NLASW website for future reference, and members may claim 1.5 CPE credits under their workshop category for attending this session today as per the NLASW CPE policy. And we also encourage you to complete the evaluation that should appear on your screen as well. And any questions that we didn't get to, we'll certainly have a look, and certainly feel free to connect. And on that note, thank you very much. Thanks, Lori, and thanks everyone. Thank everyone else for attending today. It's been a great session, and thanks for your questions that came in as well.
Yes, thanks for the questions. That really helps, doesn't it?
Yeah.
Yes, wonderful. Thank you, everybody, for listening.
Okay, thank you. Have a great day.
Have a great day.